everybody. Hello. Hi, welcome, and thank you for joining us today to what I think is going to be a really exciting event. So this is thank you to the Impact Network for supporting this improvement event. And my name is Wagner. I'm Director of Strategy and Improvement here at the Trust, and I'm thrilled to be here this afternoon. This is a chance for us to showcase our, some of you heard me say this before, our big gobs, our glimpses of brilliance that we have in this trust in the digital technology innovation enabler arena. We've got Cleveland Henry with us from NHS Digital, and I'll introduce you properly in a moment. We have got, where's he gone, Jonathan Gray from Southwest Academic Health Science Network, and more importantly, we've got all of you too. And this is a chance for us to celebrate, share, but also to work through some of our frustrations and why do things not get to where they need to be, and how can we together really try and problem solve and do that. And we're delighted that we've got our colleagues here today to share what you're seeing, but also hear what we're doing and help us to do it even bigger, better and bolder. I just wanted to say a few words. Technology, as we all know, touches all of our lives, in every part of our lives. And there's quite a lot of reports that are saying that actually the NHS is a bit behind the curve generally on this compared to other industries, maybe a bit risk averse in areas, maybe we use IG sometimes as a block. But actually, as digital citizens, we expect technology in everything that we do, don't we? So if it can help us look after ourselves, if it can help us with health and care, if it can help us look after other people, why wouldn't we want it to be part of healthcare? There are glimpses of brilliance everywhere on technology. It's just about the scale deployment where we maximise the benefit of that. The reason it's really exciting here is because we're an integrated care organisation. So we've got that opportunity to really cross boundaries and do something really dramatic. And I think, I'm sure you're aware of this, our population demographic gives us a real challenge too. They say if we can do it down here, they can do it anywhere. Apparently we're 20 years older, probably me personally, but 20 years older than the rest of the population. So we need to come up with fantastic solutions to support ageing well. So we're going to have this fantastic session. It's running in two halves. We're going to have a fabulous keynote address, no challenger, from Cleveland Henry, and a Q&A. And then we're going to have a fika, which is a chance to have an informal social chance to talk to each other and share before we come back in this afternoon, and then we showcase and share some of the huge innovations that are happening, and then explore what more could we do. It's called Technology is the Easy Bit ? Technology is an enabler, isn't it? It's not about the technology, it enables us to do something brilliant. So today is all about that, and it's about us challenging each other and sharing with each other. This is the fourth of these impact events, and we're really pleased with the turnout, and we really hope that you can stay with us for the whole afternoon. So Cleveland Henry is Programme Director for Digital Collaboration, Innovations and Digital Futures, get that on a badge, at NHS Digital, based up in Leeds in West Yorkshire, but obviously that's a national body as well, and I'm sure you'll tell us a bit more about that. And Jonathan recently returned to this country from New Zealand, from Canterbury, I believe. Auckland. Hiya, Auckland.
Thank you.
And as you know, the ICO model here, the integrated care model, is based on a lot of the New Zealand system. So again, it's a chance to run that full circle and hear from you too. In terms of the logistics in here, if the fire alarm goes off, please don't go down that way because it's a cupboard. So the rest of us will all laugh if everyone's in the cupboard. We can go that way, and facilities are all at the back. But enough from me on that. I would please like you to welcome Cleveland Henry. I'm delighted the team have managed to persuade him to come here, and we're really looking forward to hearing what you've got to say. Thank you.
Thank you. No one clapped me before I talked. So I've just come down from sunny Leeds. It's always sunny in Leeds. So I was quite surprised, not surprised I suppose, when I got here and I saw clouds, a bit of fog as well. And Leeds being my centre of the earth, my hometown, born and bred there in Jimmy's, if anyone's ever heard of it. In fact, Davina McCall was there only last week doing some TV programmes, so it was good for her being at the centre of the universe that is Leeds. Getting down here, I had to come through two borders, the usual one at Watford, and then there was another one at Exeter that sort of brought me here. So it's a pleasure to be here. As Anne says, I have the longest job title in the world. I work for NHS Digital, the national body, so I have a national role. And I do a couple of things. I think everybody in the NHS has two jobs, so I have at least three. And I get, so as well as doing a day job in delivering some national services, and I'll talk a bit about that as well, I also get a great opportunity to travel the country and often internationally to have a look at what innovations and the rest is taking place out there. There's some absolutely amazing innovation taking place. Some real, for me, innovation is the art of the possible, what we can do and how we can change the way we've delivered services. I was saying to Darren only earlier, the NHS was created in 1948, this great institution that we all love, and we're still delivering the service in the manner as though it was 1950. So we need to make some changes and some positive changes, but never lose sight of, what we're here to do, and that's look after our loved ones and individuals that we know and care about. So hopefully, has anyone seen me speak before? Good. Because I'm going to repeat loads of things I've said before, so that makes it easier. I created this title for a keynote probably about 6 months ago, maybe. One of the big events where I were presenting to a really large audience of real mixed bag of individuals, various different roles, different organisations up and down the country. And I threw this in that, when you do presentations as often as I do, the organisers always contact you 3 months before and says, right, we need the title of your presentation and we need a synopsis of what it's about. So I was thinking on my feet and said, I ain't got a clue what I'm going to, 3 months. I usually sort of do the presentation a week before. So came up with this, and I thought if I frame it around this, I can then build on it. And since then, I've used this title quite a lot. So that's what I'll talk about. In a quick synopsis, I'm going to give you a bit of an overview of what's going on nationally, and then I'm going to talk, and you'll see me talk forever about lots of different things. And I try to keep bringing it back to say technology is the easy bit. I shouldn't say that. I've been 28 years, I know I look younger, 28 years working in technology, and I've made a career about trying to show how complicated it can be. So me saying it's an easy bit is probably a bit of an oxymoron. So let's go, eh? And I'll probably say quite a lot of things that are stating the bleeding obvious, as we would say up in the north. So bear with me. So I think this couple of the slides show a quick picture and the dynamics of where we're at. I think I always start by saying we all know the makeup of society is changing right now. In the UK, the numbers of aged over 60 is set to rise by 46% over the next 20 years. Population of over 85s will be more than double in the next 12 years. Currently, 2/3 of individuals nationally admitted to hospital are over 65. GP spending on frail and elderly patients is estimated at more than 5 billion, and we're expecting that to continue to rise over the coming years. I think and you guys will be aware of this, more than a quarter of hospital inpatients have dementia, and that's concerning. But at the same time, we are treating more long-term conditions than we ever have done, a lot of it related to lifestyle. And obesity in the UK has increased by 92% since 1996. All very frightening. Type 2 diabetes, nationally, we're spending around about £10 billion a year. And that figure is continuing to rise year on year. So, we know that. And new treatments are transforming and available to support and assist people in transforming people's lives. But this puts a further strain on the already strained finances that we're all aware of. I haven't seen the total figures yet for the last financial year, but the cost of staff, capital, operating costs, drugs for 16-17 increased by 3%. So that's a continuing strain of where we're at. I suppose that the backdrop of that is we're also facing and in the middle of a technology landscape changing time. With a mobile technology, I'm sure most of you in here have a smartphone. My 84-year-old mother, she'll hate me for saying 86, has a smartphone. So, we're all getting there. Everyone's moving on. But what's quite interesting is that we're actually using these smartphones and digital technology in everyday lives. When was the last time you went into a bank? People are ordering groceries. They're now booking holidays. Do we still have travel agents? Maybe not. But what's quite interesting is we often see health very differently. And I was talking to Darren earlier about an analogy I have. When I was younger, and someone may or may not remember this, I remember watching a cartoon of a sheep that was getting into a car. And this sheep was, mild, gentle, and then got into a car. And as soon as they shut the door, they became a wolf and started driving aggressively, etc. And they got out of the car and became a sheep again. And the reason why I talk about that analogy is that we in the NHS and patients and the rest of it, we do everything else online at the moment, our shopping, our banking and all the rest of it. And then we walk into our NHS environment and we almost chuck them away and go, actually, do you know what? Where's my post-it notes? Where's my paper pad? So there's an element around us as well embracing that technology change. And just to show that, the speed of the evolution, can you realise that the iPhone was launched in 2007? Doesn't seem that long ago. The iPad followed it really quickly in 2010. And one of the reasons why I talk about those dates is that the revolution in technology is actually quicker now than our political cycles. So greater than that, much quicker than that period. And as I said, we are now reaching universal usage or near universal use of smartphones. And that's across most ages and most social groups. So don't believe when you hear individuals say it only works for the youngsters or it only works for the middle class. It's actually out there now and it's really starting to explode. In fact, only 2 weeks ago, I was at a session at the House of Lords where an ex-homeless person was talking about smartphones being issued to the homeless that helps them on discharge. We've given them information on when to take your drugs, but also given them information on what they can expect during this period. And he said, which was quite interesting, he said, we all probably think, you give a homeless person a smartphone and they'll sell it to buy the next bottle of cider. That's rubbish, is what he says. If you give them a smartphone, it becomes a possession of theirs that they care for, and it's actually they can see some benefits from it, they will hold on to it. Sadly, after the £10 pay-as-you-go SIM card runs out, the only way they can get Wi-Fi is by hanging around Starbucks or McDonald's. But, that just shows what is possible for us. And with this smartphone sort of explosion, I think what's quite sad, as well as a reality, is that we're spending on average 2 hours a day playing with them. That's longer than we've ever spent on computers or the national use of computers. And, it's constant, it's moving. And what we're using our smartphones for are much more sophisticated tasks than we think. So 65% at this minute of smartphone apps that we're using feature some sort of machine learning. So it's assessing what you're doing and potentially directing you or changing its course of actions. So that's all great. We've got the big challenges we know about. We've got the great opportunity that the technology evolution is bringing us. But actually, there's now becoming a greater reliance on health services being digital or using technology in a health service. I'm sure everyone knows and loves NHS 111, and no, it doesn't send everyone to hospital, to A&E, although, I've seen some stats that tell me otherwise. But don't worry about that, that's a different story. But it was very busy in December, as you can see. 1.6 million calls came through, 54,000 a day. That's a significant amount of calls coming through. December, in particular, was very, very busy, as I'm sure, although 6 degrees warmer down here than the rest of the country. Probably 12 degrees warmer than Leeds, to be honest. We had some challenges up there. One that I'm very, very proud of, as you may or may not know, I used to run NHS Choices, ran it for 3 years. So if you love it, it was me. If you hate it, it was my team. But it just shows, individuals that are using NHS Choices every day. When in my latter time during NHS Choices, we were getting about 1.5 million people using NHS Choices every day. And it's really, really interesting, the usage pattern of how people are using that. So it's common, Monday mornings are very, very busy. And can you guess what the most popular condition types that people are looking for on a Monday? Anyone? No. You obviously not been to the parties that I wasn't invited to either. Sexual health. Weird, but that's what Monday mornings were about. And then what you then see during NHS, for NHS Choices, is the patterns of people going to GPs and hospitals. So you go and you have your consultation, and your doctor, he or she, is telling you things, but you're not really hearing it. But you hear a few words. So what you do is you walk out the GP surgery and you pull up NHS Choices on your phone and you read about what they actually said, and then you start to panic and you read a bit more. Or you don't panic. Interestingly as well, the storylines during the soap operas also sets off the demand of people wanting to find out things. My mother is a big fan of Coronation Street, not me. And apparently a few years ago, when I was running NHS Choices, Steve McDonald's had a brain hemorrhage. Is it Steve McDonald in Coronation Street? I think that's his name. And you should have seen the influx of traffic that came through around that, around the curiosity, around everyone had a headache or whatever his conditions were, and finding out there. So individuals are using those channels and those new channels to find out. One of my philosophies when I was running NHS Choices was, if I can provide the information at someone's fingertip that stopped one other person going to the GP inappropriately, then I was winning. I was delivering something to create greater capacity that someone that needed it. So we've got, so it shows that people are now using some of the services that we've been delivering for some time. And some of the services we deliver today. So I'm sure it's no surprise to you that 1.3 million items are prescribed daily electronically alone. And over 100,000 initial appointments, it's actually greater than that now, are being booked electronically as well daily. So I just thought I'd give a bit of a backdrop and some numbers of where we are. I also want to move into give you guys a bit of a national picture of the things that we're doing, you'll hear about in the press. You'll hear about from the various leaders in the NHS that come up with all these really great ideas that, we don't understand why you guys are just not getting on with it and just delivering it. As I mentioned earlier, so I work for NHS Digital, and we exist to provide technology, ultimately to improve health and care. That's what we're there for. We're a national organisation charged with the maintenance and the development of backbone IT infrastructure and all the technology that goes, and actually to try support the changing and the growing demands. That's what we do. That's what we're here to do. As part of the 5-year programme, we were given, I'd like to say, or invested £4.2 billion to deliver a whole host of forward-thinking and digital transformation activities and solutions to support all what we're trying to do. And then, you can see, probably can't see at the back, some of the areas of focus that where we try to deliver a number of areas. So in GP land, as I call it, there's a whole transformation program that is currently looking at the future of GP SOC. Does it continue to be the duopoly that is EMIS and TPP and the others that just have a couple of practices? Or is it a different model of delivery in there? There's also things around urgent and emergency care and how can we improve that through digital technology, both nationally to allow and to support locally. There's a whole host of individual programme areas, 10 domains that we talk about in where we're focusing on. And that 4.2 billion is not just kept in the very beautiful ivory tower that we sit in the centre of Leeds, but we are using that in partnership for some delivery, but also working with local organisations, regions, and the rest. It's a lot of money, and it better make a difference, when we get to this end of the 5-year period, although I keep seeing dates and deadlines move slightly to the right as we do that. But I think what's really interesting for me is the one thing I always say, and you look at some of the focus areas that we're talking about. A lot of it is about patient empowerment, and a lot of it is about digital technology at the fingertips, both of us or you guys as healthcare professionals, and also allowing our patients to start taking care of themselves, or really understanding and being at the heart of the system itself. But I think as well, one of the things I always say, it's not just about digitisation for the sake of it. And it's about using the technology to improve lives, to improve support for clinicians, nurses, social workers, and as I say, put those services at the fingertips, and do it with the money we have available. Because it's not a never-ending pit. So we've got to make sure the money goes as far as it can, and actually ensure the money goes in the right places to deliver those services. I'll go into a bit deeper area of that, and the way I sum it up is you can simplify all the things we're trying to do in 5 key areas or 5 key outcomes. As I said, big area around empowering the patient, so the patient having access to information, services, etc., at their fingertip. We talk about, and I did a stint in banking, and in banking we talked a big significant direction about channel shift. We looked at the way people were accessing banking, some really simple, real analysis that we did. So 87% of banking traffic took place Monday to Friday between 12 and 2 p.m. And then within that, less than 20% actually needed a person-to-person interaction. Can I have a bank balance? Can I pay a bank account, etc.? And one of the things and the reason why we did that, obviously banking works around profits, etc. But it was really about, there's 2 things. If you ignore the profits and the stuff, hard to in the banking world. But the reality was about giving the customer, me and you, what we needed as quickly as possible. And actually, by creating that capacity, those that needed more complex banking needs could actually get to a teller and get to an individual. Because what would often happen is you wanted to speak to someone about a mortgage, but you was in the queue with people paying bills, and you got to 55 minutes of your hour lunch break and you walked off and went away and didn't actually get your complex banking environment or requirements dealt with. So we looked at how we could channel shift, how we could deliver services that gave the customer as they were, what they needed at a time and place when they needed it. And as we move to online banking, the majority of online banking takes place now between 6 p.m. and 9:30 in the week. And that's when a lot of it happens. So, just by putting that and looking at it in a different way. So health is extremely different. However, there are some similarities in particular around being able to take action, being able to access information, and being able to get that reassurance and the rest in your own hands, in your own time. I've just seen a great example of some great videos that the guys have created that allows individuals in their own safe, comfortable environment to absorb, learn, understand, particular pathways, particular things they need to be thinking about and considering. And that is about empowering the patient. That for me is really about empowering the person, should I say, and empowering the individuals that are with them and their loved ones and the rest. And I don't want to get too emotional about all this, but 12 months ago this week, I lost my father, and he had amazing care during his end-of-life care. Was absolutely amazing. But that sort of made me think about what is it I need as a carer of my elderly father during that period of time, during that time where it's emotional, where we're in trauma, etc. And actually being able to have information that I could absorb at the time with my father was what made and helped and supported that period of very sadness, but were allowed me to be able to support him and me to be supported during that patient. So we can do more of that. And that's really what Empower the Person's about. And, supporting the clinician, very simple. That's what we've got to do. Give you the tools and the equipment and the rest that allows you to be able to do the day job, which is healthcare, and not spend all your time pressing buttons on a computer system. You guys are, an exemplar for integrating services. We need to do more of that and ensure we do that. We need to provide a whole host of systems and services that allow you to manage the system effectively. And when we talk about manage the system effectively, we're talking about moving the needle, moving the dial from reactive to proactive, being able to do real bed management across a region that really looks at not yesterday's bed status, but what is the predicted bed status, and taking the action beforehand so we can manage manage the system more effectively. And also importantly at the same time is about creating the future. We've got to be really, really careful that what we don't do is deliver yesterday's technology for tomorrow's problems. So we've got to start creating the future and really working in that space. So a few examples of the things we're doing and some of the focus areas. I'll go into some in a bit more detail, but some of the things that we're doing is we're giving patients single secure points of access for personalised information. You may have heard of Citizen ID, which is going to allow individuals to securely log on to digital services and be able to get hold of either national or local services, knowing that they're in a secure, connected space. You may or may not have heard about a lot of the work we're doing is trying to roll out free Wi-Fi across both primary and secondary care and the community. So that's a big program of work around just enabling Wi-Fi for two reasons. One, enable it for the healthcare professionals to be able to access things without having to go to these wired boxes here, there and everywhere. But also for patients while they're in the environments to be able to use and get access to health information that will assist them in what we're doing. Some of the other areas I'll focus on as well, apps and wearables, big opportunity, but also a big challenge. There are currently more than 165,000 health-related apps available on the Apple Store, Google Play, etc. Somewhat confusing, somewhat differing quality, some very good, some not so good. That's a nice political way of saying it. But a lot of it is quite confusing at this second. So one of the things we've been doing in the centre is we've created or attempting to create a bit of an apps library. So there's two things we're doing. One of them is we are endorsing some apps and actually, giving people the reassurance that the NHS has looked at it. But also the other thing that we're trying to do is a lot of signposting. So, this could be an app that could support or assist or give you information and really work in that space. So, apps and wearables are some great opportunities. That's where some innovation really is. Some of my friends and colleagues that work in mental health and talk to me about some of the really early signs of mental health around sleep patterns, and how we could monitor that remotely by just giving a bunch of people a wearable. And, sometimes people will say the other side, well, which wearable is it and how accurate is it? And as the consultant that I know says, he goes, I actually don't care how accurate it is to the minute detail. It's the exceptions I need to understand. And that's, being able to, and you guys are a great example of that, of being able to try and be willing to try out some of the innovation that is available to us. And as the price point of all these things like wearables become much cheaper, we've got to start looking at what are the benefits of doing so. I was in a thought leadership discussion about 2 years ago, and we talked about, it's one of those ones where you throw different ideas out. And someone said, why don't we give the population a wearable? And actually, I watch my wife at the moment. I bought her an Apple Watch for her birthday. And she and the bunch of girls that have book club, a bunch of them have now got Apple Watches. And they're all connected and they're almost competing with each other to hit their step targets and their activity targets. And you can just see, that very simple device and very simple usage is actually encouraging activity in that group of individuals. If we could do that around the rest of the country, not necessarily getting everyone the however many very expensive, not worth it Apple Watches, but cheaper equivalents that are available out there. My 13-year-old daughter has one that she bought on Amazon Prime for £14, and it's very, very good. So, there's some real opportunities, but also some focus areas in what we can do with apps and wearables. And there's a lot of things going on in there that, I'm sure you guys have seen, and we can talk about that as well. Some great apps out there, helping managing COPD, general health apps, tracking levels of activities. There's some really, really good stuff out there. Some of the best things I've seen work around managing stress, anxiety, depression, in that sort of mental health space. And I talked about individuals being able to get access to things that they can access in the comfort of their own home or their own environment, wherever that may be. And, the apps and the wearable space is some great opportunities. NHS.UK, the next evolution of NHS choices. How can they kill my baby? But it does need to move on. NHS Choices started in 2007, the same year as the iPad. I was in the press, you may have seen, when I was able to announce that NHS Choices had received its billionth user. So between the first 7 years, we got 1 billion visits to NHS Choices. But in 2017, that shows people using it and accessing those types of services, we attracted 500 million visits in a single year. So we're actually seeing that, that explosion of information, the need for information and people wanting to access that. You can already access, symptoms, conditions, medicine pages, Couch to 5K, a lot of public health information on NHS Choices. But it's going to continue to evolve. Some of us already get hold of online repeat prescriptions, booking our appointments for you there. But it's going to start getting even more personal. It's going to evolve to, I talked about having this citizen ID that allows people to log on and connect and be in a safe environment. And it'll start presenting personal information, actually start providing some information that relates to you and me as individuals and allows it to work around our particular conditions and the things that we should be aware of, be it public health, be it information, be it signposting to local services, or signposting to areas and services or opportunities that you can get hold of. So it'll become more personally relevant. NHS Choices has been great, but it's been a bit of a blunt instrument. Provides some great information, and it's really moving towards allowing that national delivered, more local feel. And really about me. And you watch this space as it goes through. Link to NHS.UK. You will see very soon. When's our birthday? Is it the 4th of July? I think it is. I think you might see, if you've not already heard, Jeremy Hunt announcing an NHS app that is linked to NHS.UK. The less I say about that, the better, especially because I'm being videoed and I don't want anyone to repeat what I might say. One of the, as much as all this digital opportunity and digital engagement and getting people, everybody's got smartphones, etc. One thing we can't forget, and it's a real plank that goes for everything we do, is around those that are not digital, and really about ensuring that we widen both digital participation, but also not exclude individuals that are not connected. And, that is often, even though, oxymoron to what I just said, the older, the poorer, the homeless, the disabled, those cohorts of individuals that are not the everyday pick it up with the super computer, the £500 phone in the pocket. And we've got to make sure that our services, as we introduce greater digital services and greater access and make it more personalised, that we don't forget the furthest to reach and those individuals. So all our programmes, every programme of delivery that we talk about also looks at the digitally excluded and ensuring and how do we widen participation. So we're working with a number of organisations, it's not the Good Food, is it? The Good Things Foundation. I'm obviously hungry. The Good Things Foundation, a number of projects and charities up and down the country in around getting individuals involved in becoming more digitally able. Interesting fact I found out again the other day. So just over 11.5 million people in the UK have never been on the internet. So as much as I talk about everybody having the phones and everyone having access, there's a significant amount of individuals that still don't even get access and don't have access to the internet. And we've also got to always think about that as we deliver these great services. One of the last things I'll mention about NHS.uk, and I'm sure you've all seen and have had more than enough emails about GDPR. Through NHS.uk, individuals can now set their preference on the use of their data, whether it's just research, whether it's been shared or otherwise. And there was a campaign, meant to be quite a big campaign, but I have not seen much about it, last week on the day of GDPR, that really announced being able to take control and set the preferences of your data in health. So we need to do it better than we did nationally with Care.uk, remember that chestnut, which was a great idea, but it was badly publicised. Anything that comes in and is delivered with the local pizza and fried chicken is always something to be wary of. So we've got to get better at really ensuring individuals are able to set their preferences and the rest in a simple manner when it comes to preferences and use of data. Big one, and you guys will know this more than me, around transforming acute care. That's a significant area. And I'm waiting to see the numbers that come through for this year, which will be quite interesting. But if you didn't know, 24 million people presented at A&E in England in 2017. And that's up 30% from 2005. It's one of the areas we hear on the press so much about, the pressures that we're under. And we almost sort of, I'm not sure, did people get comfortable to say, it's just winter and it will calm down? Everyone that I speak to are now talking about this sustained, and winter seems to be continued. And we've got to really think about how can we support this sustained pressure that's only just gonna continue. And I started by saying, good old NHS, love it to death, been running since 1948. But we've got to start thinking now about how can we deliver services differently than we always have done. Turning the dial from fixing people when they're broken to let's stop them getting broken in the first place, where possible. And also creating and finding ways of creating that capacity that allows those, such as the banking environment of people that have the more complex banking, those people will always need, some people will always need a more complex health interaction. And we need to create that capacity that they can be seen to in a timely manner, in the right fashion, while all the rest of the stuff, but you get it a lot down here, people queuing in A&E, struggling with sunburn. Go away, do something else. Let's ensure that we can find the way we deliver services to individuals that need it, and channel shift those that don't need that at that time and place. So we're doing a lot of work in there. We talk about triage and decision support. So underpinned with the lovely NHS 111 is a series of algorithms that asks, as you can imagine, a whole host of questions and gives the call handler a series of questions and a series of directions of questions and working around that. That's quite sophisticated. Actually, before, it's called Pathways, and before that was introduced, just 1% of calls to our emergent to 111 were closed by sending an ambulance, and now, no, let me flip that round. Less than 1%. We've got so much better at that. We've done like tenfold increase in improving the algorithm that is being used, that's diagnosing people, that doesn't just say, yep, ingroin toenail, send an ambulance. So we're getting better at that, and we're looking to introduce even greater technology and solutions around that, around not only getting it more dynamic with things such as machine learning, but also using data much richer than it has been used in the first place. So typically when you go through 111 today, it's a very linear. You start at base 1 and it starts the collection of information. But actually by using the information and individuals' information to actually understand patterns, trends, and otherwise your point of entry has already started doing some of that diagnosis and an analysis, as opposed to you coming in at the first point. So we're doing a lot of work in there, and really also ensuring that the directory around that allows individuals to be sent or advised to go to the right point of care, or otherwise, and that point of care could be self-care, the pharmacy, the walk-in centre, and not necessarily always just go to A&E. So really ensuring that that's also rich, but not only rich, but also uses the dynamic information about wait times. And I know you guys have been doing some stuff like that, you know, in particular in areas where they have multiple A&Es, send the person to the lowest queue, and really look at doing that. So it's evolving around that. I think I always talk about communications, and I think technology and innovation give us some great opportunity to use to a greater fashion. You know, we've now got, although it's taking time to become completely universal, but the sharing of electronic records, there's been a lot of discussions and debates around that. There is continuous lock-in by various vendors. You know, whose record is it anyway? And those conversations and decisions will continue. But I think it's important about driving that seamless flow of patient information. And we're working very hard across the whole landscape to do so. So that's one element of it. I think as well, in looking at, and you guys are a great example of this, of looking at ways of we deliver healthcare today. So an example I'll talk about very briefly is at the Royal Free, only because I was personally involved with it, but you guys are doing it as well. And what we did with the Royal Free is we ran a pilot that worked with neurology and acute medicine departments. Because what we did is we stood back, even me as a technologist, and said, tell us, how are you doing? How are you delivering this service today? And they talked about, you know, a patient being seen by the medical acute team, and then needing to make a referral to get a decision or a second opinion from a neurologist, so that, you know, send off and getting them an appointment, and the person would come back 3 days. Bit of anxiety because you're a bit worried, you know, you needed me to see a neurologist, etc. So we said, right, okay, let's have a look at that flow. How can we make it a bit more simple? So, and, you know, capacity demands, etc. all came in. So what we said was, what if we made a neurologist available via video? So at that point of second opinion, we'd just tap in to that individual, and you can have that video conversation and consultation with the neurologist there, with the medical acute team there, the patient, often a member of their family as well, and actually have that right there and then, and get a decision and get some answers out there. And we did that for about 6 weeks at the Royal Free. The feedback was amazing. From a patient perspective, the whole, yeah, I'm getting the answer right now, I'm not having to wait. From a healthcare professional, was quite funny. In fact, one of the key doctors there was a big supporter and said, why the hell have we not been doing this before? Why have we been continuing to run through the standard operating manner in sending out an appointment, that person then comes and sees me or doesn't, and we have to get another appointment, etc., etc. And just using a real simple solution that just changed the whole pathway. And Royal Free themselves are doing it. The pilot is no longer a pilot. It's happening. But to do so, they had to break a bit of protocol, because the rule book says you shouldn't do it that way. But individuals were willing to take a risk, and the feedback that has come back from both sides of the fence has been amazing. And that's just, you know, real simple fashion in using simple technology that's available to us without spending millions of pounds in delivering better care. And we want to see more of that. And I know you guys are a great advocate and of such. I can't have a conference without talking, or I can't speak without talking about artificial intelligence. It's the latest big thing. And decision support in machine learning. And again, I sort of digress. What we saw very recently with a product using DeepMind is machine learning at its best in playing the world's greatest chess players that can't be beaten. And good old DeepMind, through Google, created a system called AlphaZero AI, and it was able to learn all the rules, predict all the moves, and then play the greatest chess players in the world. It never lost a game, playing 100 games, having spent only a couple of weeks learning patterns of movements, etc. So it never lost a game. It won the majority of them and drew a few of them. But this was, a real breakthrough in showing some of the possibilities of what you can do with rich data, machine learning, and using AI. So that was a really interesting experiment. And yes, there are still some improvements and uses that we need to continue to perfect and refine in health, but it gives us some real great opportunities. If you haven't seen it, one of the things I always point people to is the Mayo Clinic in their augmented decision making using AI and machine learning around cancer diagnoses. So simply feeding the data that looks at hundreds of thousands of historical cases and allows you to enter what you're seeing from that individual and actually starts giving you some greater probability. So it's not taken away and saying the computer gives us a decision, but it gives the healthcare professional greater insight and greater information based on a larger cohort of individuals, hundreds of thousands of individuals and millions very soon. And it allows them to come up and think of and assist them with some of the decisions that we'll be making around the care pathway. So some great opportunities in there. We've seen it as well with imagery. One of the great solutions I saw, I think it's now happening in the UK, but I saw it in Copenhagen where they were taking a picture of a mole, send it up to the cloud, and because of the quality of our phones now, they can expand the picture and looks at it pixel by pixel, and then send a result back, assessing it against a few of a million pictures of moles that basically gave 3 answers to the patient. Don't worry about it. We might need to check that again. Get yourself down to the doctor. Really, really simple. And what they have already seen in this pilot area in Copenhagen is a reduction, positively, a reduction of people coming to just have their, the worried well, etc. But more importantly, an increase in those that are coming earlier because something's been seen. So it's just, showing what we can use with, the new technology. It's not that new, actually. Machine learning and artificial intelligence has been in existence for many, many years. But we've now got a great opportunity to start applying that. And we've seen some great use cases and some great pilots and some great tests. Watch this space, is what I'll say in that space. So, lots going on, lots happening. And I think I always go back to some of this that talks about, we talk about innovation. We talk about innovation and technology revolution as though it's something new. And I think the NHS has constantly been an innovator in all the things that it's done. From way back when in 1953 in the heart and lung machine, MRI, I think for me is still one of the greatest innovation that's ever taken place in health. I still think it's fascinating even now, what we see. And, we're now seeing the new bit about digital patient services. What is the next? I did an interview last week. Was it last week? Yeah, or whenever it was, for the pending 70th birthday celebrations. You're going to see lots of videos and stuff. And I was asked, what do I think the NHS is going to look like in 30 years? But I'm not going to do a spoiler. I'm not going to tell you. But you can ask me a couple of things over thicker later. Still sounds like I'm swearing. And I'll give you a few. But, it's going to be, I do believe that we will continue to innovate as we have done throughout the 70 years. And we'll just innovate quicker, So we won't see these big milestones. We'll start moving to years, and then we'll start moving to months with the innovation that we will be introducing across health and care. I think nationally we sometimes get quite a bad name. We live, sadly, in the past, and we made a number of mistakes in delivering technology in the past. I'm sure everybody's heard about NPFit and I think it was £13.1 billion that we blew over a period. There were some positives that came out of NPFit, regardless of what you say. And we continue to deliver at a national level some major national services that are relied on and are successful. You know, Spine 2 that we've now run in-house, we're saving significant money by doing it ourselves. But also, interestingly, Spine transacts over 2,000 transactions per second, which is greater than MasterCard. So, you know, when we talk about technology and we talk about the NHS and we say we're behind in time, to a lot of industries, no one has the scale of the NHS, and we've got to use that to our benefit, but also, work with it. I'm obviously biased, and I had to get another one of my programs, which was NHS Mail 2. We deliver a national email service across health, and we replaced it. I hit the record books. I say hi. Have you not noticed the theme? When it's good, it's me. When it's not, it's the others. So we hit the Guinness Book of Records for the largest single email migration ever undertaken in the world when we introduced NHS Mail 2. And it really looks at delivering a secure solution that allows people to pass information around health and care. With now 1.3 million users are on NHS Mail 2, and it's better than it previously was. It does give the platform for greater collaboration, be it within workflow or otherwise. But there's some great opportunities with that. Personally, I think we will see the death of email in time to come. Having an opportunity to work in innovation, I also use my children as a good test bed. My 13-year-old says she uses email for one thing and one thing only: password resets. She said, "Why would you send someone an email when you could just have an immediate instant message conversation, or just have a video conversation? Why would you send an email and wait for someone to get back to you 4 hours later?" And it's like, you got a point there, Elise. Yeah, I'll send you an email with the answer. Just from a national perspective, we are looking to continue to deliver a number of the national services, but also make them more local, relevant. One of our biggest challenges and one of our biggest deserved criticism when we delivered a whole host of national services is that we sat in our ivory tower and delivered the solutions as we thought they would be used. And we didn't get close enough to the individuals that use them every day. And that's been a real big lesson for us. So where it's appropriate to deliver it nationally, we should do so. When it's not, we should support. And that support can be all sorts. That support can be technical support. That support could be money. Whatever it may be, we've got to get the balance right now between what is delivered nationally and what can be delivered locally, and how we adopt that. I've talked about that. There you go. Spine, big numbers, lots of stats, 6 billion messages, all that sort of good stuff. Oh dear, 10%. That's telling me I've not got time. I've also talked about that. We do a lot of stuff on email. It's huge. We use too much email today. Really inefficient. We often, and when we look and do something, we obviously don't read the details, but when we look at the email traffic, I've seen a single document sent 600 times around one organisation. Surely we can do it a bit better than that. So we use too much of it, but we also rely on it for the right reasons. Some great numbers in there. It's secure. It's world record breaking. You would have seen the another one of the centre-driven directives about the use of e-referrals nationally, and everyone's going to be paper-free on e-referrals by the 1st of October. And lots of people are now tapping up on Twitter and the likes and showing, my trust is now paper-free. So I'm hoping Torbay is going to join the movement. And if you're not already there, you're going to be there before that date. I think as well, I often talk about some of the big solutions, innovations, etc. that we deliver, and we all talk big numbers, etc. We also deliver some real simple things, but really important things. And if you've not heard or seen, child protection information sharing is a really simple solution that makes a profound difference. And it's about flagging children that are at risk or vulnerable, so that whenever that individual is presented at a point of care, generally A&E or whatever, the individual who's caring for them is able to see the last 25 presentations of where they were, what it was, etc. And where that really sort of came in real was a really sad case. There's a big review that took place after a serious case review, where a 21-month-old child, while in the care of a mother, she was murdered by a mother and a mother's boyfriend. And what it showed, obviously hindsight being the great thing, but when we looked at, or when the review looked at the instances, what the mother and the boyfriend were doing is just taking the child to different A&E centres, different walk-in centres. So each time they went to that place, it was seen as a first event. And eventually, quite sadly, that poor child was murdered over a series of, not murdered by one event, but a series of events that took place. And one of the recommendations that came out was that CPIS, we love an acronym, so Child Protection Information System, should be universally used across the whole of health and care. And we're getting there. We've now got 85,000 children flagged as vulnerable, which is a sad indictment on its own. And as much as the percentages are increasing across health and care organisations, it's not to the level I think it should be a no-brainer. We should just be doing it. And a real simple solution, as I say, that we deliver nationally and has some real positive, or should I say, avoidance actions. So yeah, we do all the flash things and the rest, but we've always got to come back to some of the simple things that make a huge difference, and it just shows what technology can do. So I talk about big systems, etc., all the rest of it, and really about everyone using, and we've got billion this and hundreds of thousands of that and the rest of it. But I think we have to be really, really careful that it's not just about the delivery of those services. It's about the use of those services. One of the stats that's not displayed on here, that I think it's something like 92% of individuals potentially have access to book GP appointments and repeat prescriptions online. But only 11% are doing it at the moment. So yes, we can create those capabilities, but we've got to also look at how we get adoption up and individuals starting using those solutions. CPIS, yeah, there's the numbers. 44% in local authorities and only 19%. I actually know that's gone up, but we're still only in the 20% of that being used. Wherever you go and speak to people, it's saying, why wouldn't we? So we've got to not get complacent with our numbers and really look to ensure, as we deliver these services, that we're also getting a great focus on what's the business change, what's the adoption, and the rest. Delivering the technology to the desk or to the tablet is only half the job, and that's the easy bit about it. So with all that's going on as well, a lot of it is around building the future. It's one of the strands I talked about, what we're trying to do. And we can't do it all from the centre. We've got to start working with the local collaborations, the local innovations, the SMEs, the startups, to breathe life into the stuff that we're trying to do at significant scale. And we've got to create, an environment where small projects can really grow, both locally or starting locally, and then more regionally, and then more nationally. And I think we also got to be really careful. It's not just about creating multiple monopolies. It's about finding what works and then seeing where it's appropriate to expand that. The 15 AHSNs that are out there now driving innovation and transformation, I think have got a really big deal, but a big opportunity nationally and more importantly locally, to broker relationships with the NHS, with the technology providers, with the SMEs, with different industries, and actually try and ignite that historical difficulty it's been to transact with the NHS. I see and speak to a lot of organisations that have tried to get through that big brick wall that is the NHS. And what a lot of innovators do is they go and find another industry, or they go down the private healthcare area, because it's really, really difficult to get in. Because, we are very busy. We've got to conform to all the IG standards and the information standards. And every solution has to be a gold-plated Rolls Royce, even if a Ford Fiesta will do. And we've got to use areas and initiatives such as the AHSNs to really start igniting and being able to really put some lifeblood into the innovations and the technology solutions that are out there for us in the NHS to then adopt and grow and become part of our lifeblood. And we at NHS Digital and NHS England and all the rest of the NHS and whatever letter you want to put at the end of it, we've got to get better at not just being sat in our ivory tower dictating the solutions and the ideas of what you've got to do. We've got to start working from the bottom up as well as from the top down and get that happy medium. So we're seeing now, and I get the benefit of, as I said earlier, travelling around the country and internationally to see what people are doing. I've only had a quick look of what's going on here, and already, my first word is wow, some great stuff. And one of my biggest, I shouldn't say because it's later on, isn't it? It's about how do we get the message of what's going on here to the wider NHS. I joked about the two borders. The biggest border is that ring around London. And a lot of the NHS leaders, love them or hate them, don't travel very often, or don't travel very far. And therefore, we often hear about some amazing innovation taking place in the NHS. How often do we hear it's been one of the London hospitals, one of the London community services, the London ambulance service? Everything said bloody London every time. And Leeds is so much better. I lived in London for 12 years, so I'm a good judge of character. I went back home because it's better. But, how do we get the message of what's going on here? Some of the things that you're doing that actually look really simple. I said to Matt as we was walking around and doing a bit of a tour, and I said, the facilities you have here are amazing. You've got some amazing facilities. I know some of those great London hospitals that would love to have the facilities and the capability and the innovations that you guys have. And Matt just said to me, which is really interesting, isn't it? He said, when you're immersed in it, you don't really realise what you've got. You don't really see how good it is. So you guys have got to get your message out, however way, that people can start hearing and seeing that with the exception of Leeds, Torbay is another central part of the universe that we should all be looking to supporting and looking at how we can support that nationally and locally. And Anna said to me when we first started talking, don't take long when I'm speaking to people to mention the money thing. There is money available, all right? But every time an initiative comes out, how often do we hear that the same places, the same people get those funding? If I hear another initiative starting in bloody Manchester, I'm gonna. So we've got to find ways of supporting you guys and other places in the country in being able to get the feet on the table, to get part of those those seed funding that is available. There's a lot of money. I often say money's not the problem. It's where it's spent is the problem at the minute for me. So, I want to try and see how we can work with you guys, drive some of that innovation that you're doing, and give you the leg up if that's what it takes to push. And, working with the AHSNs is a real key opportunity. I think, to give you a few of my predictions, I think we will continue to see more of the money for innovations go via the AHSNs. And it's a great opportunity and a great avenue. And the AHSNs around the country operate very differently, but they're doing some great stuff. So I know there's going to be a closer alliance with you guys for down here, and then we will obviously support, and I will as well. So we're building the future, and we're attempting to build the future. I mentioned national infrastructure when appropriate, local infrastructure, real big focus on data. There's a lot of power in data, or as the technologists now say, data is the new oil, and it really is. But also creating that tighter collaboration with academia, as you guys do already, but innovators, national, the state, international, and the rest. We've got to be preparing ourselves for, all those challenges I talked about at the beginning are not going to go away. But we've also got a new cohort of thinking, but also a current cohort of expectations that we've got to work and understand and start working through. Talk about a couple of innovations. Always good to mention a few. And I've seen a couple. I just sat there with my VR glasses on and experienced the consultation, which was brilliant from a patient perspective. And I thought that was great. And we're seeing more and more of that. HoloLens, as you know, is the Microsoft version of that. But there's a couple of pilots taking place at the moment with Universal College of, guess where? London. And Microsoft using HoloLens around medical imaging, around kidney cancer. I actually saw this one again while my travels, and it was pretty wow. It's quite good. But just using the VR cameras, which are now again the price point's going down. Don't have to be the Microsoft HoloLens, but the many, and we've just seen a couple out there that are giving us a way of looking at things slightly differently, and being able to get to that depth of view that we haven't been able to in the past. So we're seeing. We're seeing a lot of innovation, and you guys are a great example of that. I'd like to say, and I did mention earlier, so I'm not going to talk about it. You will see the evolution and the evolution, should I say, of NHS 111, where we will be looking, and we are now looking to channel shift. We are moving a lot of that physical telephone conversation online, and actually doing and introducing. And we have an opportunity to introduce even greater and more dynamic algorithms electronically relating to individuals, obviously when you've logged on and the rest. So we're running some pilots at the moment that are running really well. Leeds, it's on there. They're one of the pilots where we're doing online 111. And we're seeing an interesting trajectory of individuals moving and actually finding it much more comfortable with an online transaction than that physical telephone call. But also in 111 online, similar to Vodafone, O2 and Sky have been doing forever. You can start your conversation, we talk about omni-channel in this space. So you can start your conversation online and you can switch to telephone. The next best is switch to telephone, switch to video, switch back to online. And actually just change the method and the medium through a single channel entry and not having to restart that point. I personally think, as we have seen in many other industries, is that I think we will see a lot of our pathways going that way, where we'll start talking about omni-channel, start online, talk, view, touch, back online. and I think we will see an NHS 111 online 9 is talking about that. I'm not going to talk about Sharon. She's great. And I'm also not going to talk about Dr. John. But I'm going to get to the crux of what I sort of talked about, or I started about, and you know, good old Steve Jobs, bless his cotton socks, around technology being the easy bit. And Apple, I think, were the best advocate of this. So the iPad in 2010 took a while to hit the streets. And the reason why it took so long to hit the streets is because it took a long time to pass the kid test. And the kid test was basically you put an iPad in front of an individual, a small child, and they should be able to get around it and use it fully without an instruction book. And that was the test that Steve Jobs lived by, and we all have started to adopt. I'm sure many of us have now seen these very young children picking up a smartphone or a tablet and swiping away and moving around in a way that we sometimes are still amazed by. So for us, I say it's not simply about delivering some cool technology. And as a technologist, that hurts. It really does, because you know, I've spent my career delivering cool technology, or sometimes not so cool but expensive. But you know, we've got to start looking at the way we deliver technology, so we can deliver state-of-the-art solutions, you know, supported algorithms, patient-centered care. But we also need to make it simple to use, simple to access, you know, simple and intuitive designs. You know, I've seen some EPRs that I think you need a PhD in EPRs to be able to use, and that's surely not appropriate. And that's how, by delivering simple, effective, usable, solutions, if I switch actually to PC, where's my presentation on here? Oh, there. I'll keep talking.
Cleveland, we're just starting into fika time now, so just
Oh, wait.
give a sense of
I'm going to finish.
Q&A in there with Cleveland, so we want you to finish your talk.
Oh, I've nearly done.
Oh.
Yeah, I've nearly done. So, so I think, you know, we've got to be really also, and you know, the innovation teams as well as the rest of us, we've got to really look at how we deliver fast, flexible, easy to use technology to drive that uptake that I mentioned. You know, yes, the percentages of the solutions, and the way I see that is really about, this is the wrong way. Yeah, as I've just said, delivering solutions that meet the needs both of a healthcare professional but also from a user, and delivering simple interfaces and ways of using it. We've also got to, and I mentioned it very briefly a second ago, we've also got to look at the business change requirements. What is it we need to do differently to adopt to this new technology? I saw a great example of someone who just launched a new solution in an organisation up north, and introduced EOBS at the desk at the patient side bed. So the nurses were given a tablet that can actually enter all the EOBS, and the director of strategy said, "Cleveland, you know, come and observe how things are working." I said, "Oh, great, you know, don't tell them I'm here." So I watched this nurse, brilliant lady, she was so compassionate, she was amazing. But what she did, she got a post-it notes and she wrote down the OBS of each bed as she walked around. She then walked over to her desk and picked up the iPad and entered the OBS. Actually, on patient number 3, when she entered the second number, it gave her an alert and told her she needed to do something else, which was the whole point of doing it at the bedside, wasn't it? So, you know, what is it? So, yes, the technology was there. Yes, it was extremely simple. Yes, it's a no-brainer. But what is the change we need to do within the way we use it in the business? And we've got to really start focusing on that versus just, here's the launch of the product on the 31st of March. Now use it and drive forward in there. We've also got to, and the big one I always talk about is, and I'll finish off by saying, yes, we can do the technology. Yes, we can make it simple. Yes, we need to understand the business change. There's also a cultural element that we've got to adopt and understand and start working with. And, you know, culturally and compassionately, and the thing we don't want to lose is that everybody that works in the NHS knows that we're here for one thing, and that's the patients. We've also got to be very mindful of, as we always say it now, is turkeys voting for Christmas. So are you introducing a piece of technology that's going to make me redundant, make me less useful, remove my halo, whatever it may be? So we've got to work across the space with healthcare professionals, with users around what's in it for them and how we introduce that. We also need the IT departments to get out of the cage and come and speak to individuals out that are providing care. You know, so we as a technologist needs to get out of our, our little rooms and actually go and have a look at what is it that we can do, what solutions we can deliver that'll actually improve people's everyday lives. You know, what's in it for me is the one I always say. So there's a whole host of things we have to do, and that includes understanding, delivering high quality, trusting and taking a few risks with innovation, but keeping it safe. Get the business change right, get the solutions simple, but also totally understand the significant cultural change and ways of working change that's about to hit us. Depending on what you read, you'll hear all this stuff about AI is going to ensure that nobody has a job any longer. And I don't think that's the case. I think, yes, it gives us an opportunity to removing some of the mundane, simple tasks, but actually what it will do is give us an opportunity to do the things that we're really here to do, the more complex information, to more get into being the professional and the expert in my field and not filling in forms and passing paper around. So we've got to reimagine how we deliver services. Technology is a big opportunity for us, but it is the real simple bit. The rest of it is much harder. And on that note, I'm stopping you from fickering. So I'm going to say thank you for listening, and I'm here all day. It's great to be here. So thanks again.